I want to touch a little bit on this thing of invisible braces that Dr. Schabort spoke about a little bit earlier, and that it is a current innovation that is available.
Exactly. So clear braces are becoming more and more popular.
Yeah.
See, I'm wearing mine at the moment. You can't really see them.
No, don't do that.
I know. So there's really no excuse for you to have a straight smile anymore.
Yeah.
The invisible braces are there really for people that have a perfect occlusion already. So basically, the teeth occlude correctly already.
Yeah.
You can't normally shift and correct the occlusion. With these clear braces. So they are more there for the social six, we call it, the front six teeth, to get them perfectly aligned.
All right.
And the treatment time is very short. As I've said, it's 2 months to 6 months.
That is absolutely incredible to know that that is possible right now. Let's talk about the most common mistakes that people make that they can actually start avoiding right now when it comes to their oral health in order to improve it. What can they do?
Well, I think the number one problem worldwide is sugar. And I'm glad to see that sugar tax is being instated. I think that sugar should be a banned illegal drug. It gives hyperactivity and so many other problems, but in the mouth it leads to severe destruction. If you can cut sugar out of your diet, you're already making a huge progress in your health, in your oral health and your general health. And then also something that is widely available is water. Rinse your mouth with water as much as possible. Always carry a bottle with you with water and rinse your mouth as much as possible.
Yeah. We've kept our lines open for questions, and let's take a call right now. Mrs. Naidu, good morning to you.
Good morning.
Yes, ma'am. What is your question to the doctor?
I have a friend, a very, very close friend.
Yes.
And she has a terrible bad breath. I want to know, what can she use for her? It's very embarrassing for me to tell her that her breath is bad when she's talking to me. I somewhat put my handkerchief to my mouth, to my nose, sorry. And I'm just wondering, what can I buy for her, or what can she use for her bad breath?
Thank you very much for that question, Mrs.
And
Naidu.
it's quite strong.
Yes. What do you say, doctor?
So I would say it will be a good idea for her to visit the oral hygienist and the dentist to make sure that there's no underlying condition that leads to the bad breath. She can chew sugar-free gum. That can definitely help. You know, and she can just up on her oral hygiene. That is the best advice that I can give.
Yeah.
But if it's something like something that is stuck in the mouth, or maybe even the tongue, she can start by brushing her tongue as well. That's something that can lead to halitosis significantly.
Yeah. Thank you so much for that question, Mrs. Naidu, and hopefully that answer did help you. Could this be something that is born of a gum disease of some form?
Exactly. It could be periodontal disease, which is actually the disease of the bone surrounding the teeth. And periodontal disease means that your own body is breaking down the bone that maintains the teeth in the jaws. And periodontal disease will then eventually loosen the teeth. And if teeth become loose in that periodontal ligament, bacteria is harvested. That bacteria then circulates the whole entire system, and that can lead to heart disease and diabetes, which can obviously lead to death. So your oral health is so important to maintain your overall health and even your erection.
That is extraordinary to think about. All right, we've got another call on the line right now. Bai calling us from Johannesburg. Good morning to you.
Good morning.
Hi, what is your question to the doctor?
My question is, how do you treat tetracycline stained teeth?
Tetracycline stains that's antibiotics used as a child, and those stains can nowadays successfully be treated by a very intensive in-house whitening procedure. But if the stains are too deep, then we wait for the child to be of the age of 18 at least, before we then place veneers onto these teeth, which is a very thin covering onto the front bit of the teeth, and that leaves you with a very highly aesthetic outcome, but it could be quite expensive. So we first try and do teeth whitening, but it all depends on the budget of the patient.
Absolutely. Well, Bai, thank you very much for that question. And lastly, I want to touch on wisdom teeth. Should you have them removed, or can you keep them?
Well, that's exactly what we're trying to do nowadays. We're trying to maintain all the teeth in the mouth. So as a youngster, we're trying to make space so that we can keep all the teeth in our mouths. If your wisdom teeth don't pose any problem, if there's no infection, if they're not impacted, you can really leave them just the way they are. They will actually help the face with hard tissue support, which in the long run is all we need to look young.
Okay. Well, thank you so much for all of the advice, Dr. Schabort. We really do appreciate it. And thank you for all of your calls. And I think important to remember what the doctor just said, that, you know, your oral health can actually end up affecting your heart health. It can end up affecting diabetes and even your erection at the end of the day. So very, very important to take care of it while you still have it. Well, there's still lots more to come on your Feel Good Breakfast show. Let's find out.